So we actually have a good chunk of time to participate in some discussion. Now recognize everyone is still muted who is not a co-host, but we may invite some individuals to expand a little bit more on their questions or comments based on what they're seeing. So Timothy or Wilbert, feel free to highlight what's been talked about.
Wilbert, do you want me to go first?
Ladies first.
Okay. Good morning, everyone. I'm Timothy Jones, Program Director for the Bay State Women's Health Network. And one of the main comments that I picked up on when Paul was speaking was a response from Brad Palazzo from Comcast. And he felt as though some of Paul's comments regarding network capacity for individual households was not accurate. So I wanted to give Brad the opportunity to speak with regard to that, just to clarify that. If he's
Sure. Yes, thank you for the opportunity. I just wanted to point out as it related to the network capacity of individual customers, when Paul said folks, if more folks in the community come online, that degrades the level of service for those individuals. And that's just not accurate. Folks pay for a package and they receive the speeds that they signed up for. So if you signed up for a 50 by 5 with like it's our Internet Essentials program, those are the speeds you'll receive, and it has nothing to do with other folks on the network in the community. So I just wanted to point that out. Obviously, the more users that you put onto your own network in your home, it can handle a certain amount of folks, but a 50 by 5, which has become now our slowest tier, can accommodate multiple users, 4 to 5 at a minimum, doing Zoom and or Microsoft Teams conversations, and then of course regular internet searches. So I just wanted to point that out. Thank you for the opportunity.
Yeah, thank you for expanding, and I know there's some further reflection in the chat, so we encourage folks to continue debriefing these experiences with Brad as a representative of Comcast. Maybe offline, Brad, you can connect with a few folks who may want to share a bit more about their experiences, but thank you for clarifying that response.
Thank you, Brittany.
Yeah.
There's another comment by Molly Hopman, and she indicated that she wanted to learn more about the Navigator program for Motto at Caring Health Center. And Dave Christopoulos, who's part of the Digital Navigator program, did respond in the chat. So I just wanted to make sure she saw the website. And if not, it's https://www.lisc.org/rural/our/digital/inclusion/digital navigators. So sometimes it's kind of hard for people if they're not looking at the chat to see people's response. But Molly, if you can make sure that you got that, otherwise it can be included after the forum. I think we'll be following up with some emails. Wilbert, did you have any comments?
Not necessarily comments, but more questions. As you know, a lot is kind of pouring in here, and it's a task in itself to kind of decipher through that. But one of the 2 questions that I kind of wanted to highlight here, and this one came directly from Nikki Burnett. It sounds like she's kind of asking to kind of gauge some thought around best practices. So her question is, does anyone currently ask questions about digital literacy or resources or connectivity on their intake forms? So of course, as I mentioned before, this seems like this is more of a question to provoke some type of thought and perhaps give folks an opportunity to go back into their intake forms or their processes to identify if these questions are being asked. The next question that I have here is from a John Lunt. Forgive me if I'm butchering the last name, but it is, what do we define as acceptable speed for both downloads and uploads? And that is currently what I have for right now in terms of questions that I felt could potentially be asked during this open panel.
Paul, just throwing it out there, Paul, would you like to maybe try to take a stab at answering this question of what do we define as acceptable speed for downloads and uploads, if you have any perspective to share with John and others?
Yeah, I mean, I noted that John put in the chat the proposed revised standard of 100 download, 100 upload. I think that would make sense, 100 download, 100 upload. And I think the most important piece in that potential revision, right? Because I think the current FCC, I may have this wrong, but the current FCC, oh, I see it, I think, Brad, oh no, that's the Internet Essential, sorry. I want to say the current is very low, like 25 download and 5 upload or something like that as the current FCC standard for high speed, which is clearly not fast enough for multiple users in one home to be doing bandwidth intensive. But I think the biggest improvement, if that new standard would be adopted, would be making download and upload speeds equal. Because things like, it used to be when people started using the internet originally, most of what you did on the internet was downloading. But now when you're doing things like Zoom, you need that upload speed as well as that download speed. And so I think the 100 would be a good standard, but we're not close to that now.
So I have a question, Paul, just as a pickup on that. So how do we get to that 100? Is that a legislative action, a government action, or is that really a decision by the industry, internet service providers themselves? I
do think, sorry, just to jump in on that, Frank, I think the FCC sets a definition of what counts as high speed. So and anybody who's on here knows better than me, please feel free to chime in because I may be wrong on this, but I believe the current standard for what counts as high speed internet is set by the FCC. And so at minimum, if the FCC adopted a higher standard, it would mean that private providers couldn't sell a lower number and call it high speed, I think. I mean, that would be the hope, is just sort of not message to people that you're getting high speed internet for something that really isn't going to work for you.
Is it okay if I want to jump in and shift to the previous topic that Wilbur brought up, which is the topic of, for those of us who work in healthcare or social services or any helping services, the whole question of, we do a lot of different, with intakes, there's a lot of, how, sort of checking out how people are doing. And this notion of having a sort of an assessment question or two related to digital access, digital literacy, digital equity. And Nikki brought up in the chat that this, that like, it sounds like Bay State could be thinking of that as in their patient contact process. I would be very happy to help coordinate any kind of effort that, coming through the Alliance to, like, is there, should we have a little meeting to talk about, okay, what would be the questions to ask? What would get the information we need? And then what do you do? And then what does a service provider do with that information? I think it's a great thing. I mean, I know there's increasing, for example, they're increasing assessment for food insecurity that's being done in various settings. I think it would be great to assess folks. But then it's like, what are the questions to assess them? And then what do you do when you find out that somebody does not have good digital access for whether it's literacy or connectivity or equipment? Yeah, so I'm going to put my email in the chat, and if you want to have a conversation about that, or we may end up with some subgroup or something around that, and I'm just making this up independently right this moment, but let's, because this is exactly what we're looking for in this forum. Is that something that we hadn't talked about so far in the Alliance, and we want those kinds of other pieces that come in. So anyway, thanks. I'll put my email in the chat.
So in addition to chatting that, you guys should show up for Mary's group. And Mary, which group are you doing as the ACNA group?
B and Sam Hamilton and Sally Kaufman and I are chairing the Putting People First, a person-centered approach to bridging the digital divide. And this is definitely that's the topic. So yes, we'll be in that group 10:30 to 11, and following through in the future too. So if you're interested in that, I'll put my contact information in the chat, but show up at 10:30 too. That'd be great.
Great, thank you.
All right, I think we have time for just one more question or reflection for discussion before we move on to our next person.
All right, I have one more that came in from Dane Cutler, and it's a suggestion for a question. It stated, does learning that a service is only available online discourage you from applying or engaging? How many times have you declined a service for this reason?
Yeah, that's a wonderful, thank you, Dane, for adding that. And I think I've been following, there's some folks responding to that question. I also see your follow-up. What's worse, being stuck on hold for 2 hours or having a website crash 4 times, forcing you to start your application? I think that summarizes a lot of our experiences over the past years for us who have to use this for our professional lives, but can't even imagine to think about not having this access and then being expected to be able to use digital tools and media. So thank you, Dane, for providing that suggestion. And definitely we're going to debrief that more in our Act Now groups and in our broader Alliance meetings. So I'm going to shift gears a little bit. We do want to highlight 2 great pieces of news related to funding for this work and funding for action. So at this time, I'm going to invite Anna Marie Golden, Director of Community Relations at Bay State Health, to speak a little bit more about how Bay State is investing in this digital equity work.
So before I jump into my remarks, I did want to just acknowledge a few Bay State colleagues that are here with us today. In addition to Frank Robinson, we also have Jane Albert, our Senior Vice President and Chief Consumer Officer, and Mike Knapik, our Vice President for Government and Community Relations. So thank you both to Jane and Mike for being here today with us. So early in the pandemic, the Alliance recognized that not all members of our communities were able to access and use information and communication technologies. This digital divide touched all of the important activities in people's lives. It is, as Frank referenced, a new social determinant of individual and community health and well-being. People's ability to use it was essential to how well they were able to participate in society, access healthcare, obtain education, and work and build careers. COVID fostered a real urgency for a broad movement, one centered by the needs of those most impacted by the digital divide, historically overlooked and under-resourced communities. Racial legacies of the past continue to haunt current policies and practices that create unfair disparities experienced by Black, Indigenous, and people of color, BIPOC people, and neighborhoods. Racial inequities are so deeply ingrained in the digital divide. Geographic location, as we've heard today, is also a leading factor, with rural communities much less likely to have access to high-speed internet. And a large disparity also exists for those living with a disability. Our teachers, parents, and students could not fully join the digital community, and it was far more merely than a connectivity or infrastructure challenge. Mentoring, digital stewards, and digital navigators, also known as a help desk, and digital literacy training is urgently needed to help. The assessment report, which hopefully all of you have viewed, the digital divide and challenges to digital equity in Hampden, Hampshire, and Franklin counties, makes it clear that closing the digital divide will require a significant cultural change in our public institutions in Boston and Washington, and in the Connecticut River Valley's corporate, healthcare, and educational campuses, municipal governments, and civic and social organizations. It is in the spirit of the civil rights movement in the 50s and 60s and the modern Black Lives Movement that Bay State proudly joins the Alliance and also asks you to join also, whether individually or on behalf of your organization. Movements require resources, time, talent, and treasure. Starting just over a year ago, dozens of people in our region, many of whom are here today, have invested time, talent, and social equity that have culminated in the formation of the Alliance, the assessment report, and today's forum. Bay State Health was proud to join along with the Community Foundation of Western Mass in providing a planning grant to support the efforts of the Alliance over the past year. However, in order for this movement to continue and to be able to identify solutions and have the desired impact, additional resources are required. I am pleased to share with you today, on behalf of Bay State Health, that we are pledging a multi-year community benefit investment to support the continued efforts and movement of the Alliance. We are committing $75,000 a year over 3 years for a total of $225,000. The source of this funding is through Determination of Need Community Health Initiative funding related to Bay State Medical Center's current operating room replacement project that was approved by the Department of Public Health Council this past December. The intent of this funding is to address social determinants of health with a focus on systems and policy changes. With the digital divide being a new social determinant of health and requiring these system and policy changes at the local, state, and federal levels, our funding supporting the Digital Alliance is very well aligned. It is our hope that other businesses, institutions, and funders that are here today and those that are not here today are inspired to invest in this movement and will consider joining Bay State as a sustaining funder. Thank you.
Well, thank you so much, Anna Marie, for sharing that with folks in the room this morning. And I also want to invite back up Brad Palazzo, Director of Community Impact with Comcast Western New England region, to share a little bit more about their role in this work.
Thank you, Brittany. And I just want to thank everybody for attending and the opportunity to be a part of today's discussion. And, I want to give a special thanks to Frank Robinson and all the folks that have been a part of, this alliance and building out this, roadmap and plan and discussion today, and for all the work behind the scenes. It truly does take a village to correct some of these issues, and Comcast is happy to be a part of the solution. And, many of you may or may not know, we've been focused on digital equity and bridging the digital divide for more than a decade. And we have 2 signature programs, Internet Essentials and Lift Zones, that strive to help connect the unconnected in our communities. And Internet Essentials, which I put some information in the chat, offers a wraparound approach to addressing access and adoption barriers to the internet and provides high-speed internet service to qualified individuals for $9.95 a month. And we had some discussion on speeds. Internet Essentials is currently 50 by 5, which we, in the last 6 months, doubled those speeds from 25 by 3. And we're working with a network of nonprofit partners. We've rolled out Wi-Fi connected lift zones to nearly 10 nonprofit organizations in Western Massachusetts, with more on the way. And the goal there is to better equip them in serving their clients. So in joining with Bay State Health and the Community Foundation, I'm proud to announce today that Comcast is committing $20,000 this year to continue to support and establish digital equity programs that will serve individuals seeking access to the advantages of technology and the skills that will lead to improved economic mobility. So we're happy to be a part of this initiative, and you have my support on the committee and Comcast financial support as well. So thank you.
Wonderful news there too, Brad. Thank you so much. So we hope that this is inspirational for other folks in the room, potential funders, and we invite you to continue pursuing conversations with the Alliance on ways to give. I am now going to send it back to Dr. Frank Robinson to give some closing remarks and then walk us into our breakout room. So Frank.
All right. So I have you have in front of you, get involved. This is your opportunity. You will be receiving a survey, real simple, quick survey, but the survey asks for you to join us. It gives you an opportunity for getting linked to the Alliance and engaged in our future activities. So pay attention to the survey, complete it, sign up, join our digital civil rights movement as we try and drive towards equity. We're reconvening on the 29th. We're setting up work today in our, what we've called, you've heard some folks refer to it as the after party. So the Act Now meeting will begin immediately when I stop talking. You'll be given a choice to select a group to continue conversation. We expect to spend about a half an hour setting up next steps. And so please hang around, make a contribution, help design our future towards digital equity.